I want to start by talking about the record cases, over 35,000 today. That already exceeds the Health Minister Brad Hazzard's prediction of 25,000 by the end of January. What would Labor like to happen here in terms of trying to curb these case numbers? What would you like to see happen?
Well, we need to make sure that the testing procedure is in place right across New South Wales so that people can have access to a test to understand whether they've been infected with the disease or not. We need to ensure that our public hospital system is appropriately resourced. It's obviously a very difficult time in New South Wales at the moment, but we have to say we were warned that with the rise in case numbers, there would be a stress on the public hospital system, and we need to make sure that they're properly resourced to get through this difficult period.
Today, National Cabinet will meet and the Prime Minister is expected to announce it will provide millions of click and collect free take-home tests to be handed out at state and territory-run testing centres. There's concern that a mail system won't work due to temperature issues. Would Labor support a click and collect system?
Look, potentially, but at the end of the day, this should have been sorted out weeks ago. The federal and state government were warned by the Chief Health Officer at the Commonwealth and state level that rising case numbers would put pressure on the testing systems in the state, particularly in New South Wales, and not enough has been done to ensure that people have access to those tests. So I'm hearing about stories where people are waiting for 4 and 5 hours in crowded, hot conditions. Some of them are very sick before they can actually get a PCR test. Some of them are simply leaving and don't have access to a rapid antigen test. So we need to learn from other jurisdictions. This process worked in the UK and the USA. It should have been rolled out in Australia as well. It wasn't. Now I think these hybrid models may do the trick, but for many, it's very late in the day.
You've been calling for free rapid antigen tests now for the last few weeks, and a proposal will be considered today whereby low-income earners, welfare recipients and pensioners will be given direct cash payments to buy up to 5 of these tests. What do you think of this proposal?
Look, I just think that at the end of the day, it should be distributed free to everybody. There shouldn't be some kind of financial demarcation line. The Commonwealth Government has been funding PCR tests for major laboratories now for the last 2 years through Medicare. The last 12 months have spent about $1 billion on these PCR testing facilities. To extend that program to rapid antigen tests is the straightforward, common sense decision to make in these complicated set of circumstances. At the end of the day, the Commonwealth and the states' minimum responsibility is for people to be able to tell whether they're infected with the disease or not. That's not happening for thousands of families, and it's got to change rapidly.
What about in terms of the messaging today? The state government launched a public awareness campaign to try and keep citizens away from testing clinics. So billboards, there'll be mobile phone alerts. Is that enough to quell the confusion?
These measures have been put in place as an emergency measure because not enough resources were put into testing originally. That's the situation in New South Wales. It should have been ample rapid antigen tests to be distributed to the people of New South Wales. At the end of the day, the government was warned that with rising case numbers there would be pressure on both the public hospital system and the testing facilities right across this state. Not enough was done. So emergency measures like signs telling people not to get PCR tests might be necessary, but frankly it shouldn't have come to this.
Even today, there's been another significant rise in the number of hospitalisations. What more can be done to ease pressure on an already stressed system?
Yeah, it's a complicated set of circumstances, we know that. Obviously, we need to talk to worker representatives in the public hospital system, understand what the pressures are on the public hospital system. There are reports at the moment that people are being pressured to go to work in various departments throughout the public hospital system. There shouldn't be pressure put on our frontline workers. They've been the heroes of the pandemic. They've gone through a very difficult period over the last 2 years. In the opening stages of the COVID pandemic, they stepped into the breach and did the important work of protecting us in the public hospitals, not knowing the full effects of what COVID would wreak on your body. So they're the heroes of the pandemic and we should be treating them with respect.
I just want to finally just ask you again on the case numbers. Today, the Victorian government will also discuss potentially imposing other restrictions like closing nightclubs, cancelling indoor dance floors. Would you like to see the same happen in New South Wales?
I don't want to speculate on what the Victorian government will or won't do. What I would say to the New South Wales Premier is listen to the Chief Health Officer. Kerry Chant worked hand in glove with the former Premier Gladys Berejiklian over the last 2 years, did a very good job keeping New South Wales safe and protecting our public hospital system. Now is not the time to not listen to the experts who've guided us through a very difficult last 24 months.
Chris Minns, we have to leave it there. Thank you so much for joining us.
It's my pleasure. Thanks.